Welcome to RHI Sociable City Interviews, where we meet with global thought leaders on nightlife and the social economy. Today we are with Kathie Durbin, Acting Director, Montgomery County Alcohol Beverage Services. Well, hello, Kathie. It's great to see you.
Great to see you too, Jim.
Well, I'm happy that you're taking the time from this craziness that's going on around us. I know that you're operating as the Acting Director of the alcohol beverage services for Montgomery County, but you've been doing this now for quite a long time. But for people who don't understand how you get into being in a position like this, can you describe some of your background, how it is that you ended up doing this work?
Sure. I guess it all began with my years of bartending. Um, I think that it was invaluable to help me learn more about not just the hospitality industry, but people in general. I had gone to college and received a degree in social work and was wondering what to do with that while I was managing restaurants and really not knowing that I was already doing some of that. So it was pretty amazing to really be in that people world and that world of hospitality. Um, while I was doing that, I came upon a position in the restaurant association, the local restaurant association. So I became the executive director of the local Montgomery County Hospitality and Restaurant Association for a few years. I was quite young, but I was guided by people that had been in the industry their whole lives. And we worked for small business. We went to Annapolis and worked on legislation. At the time, it was the big chains coming in and really the small businesses feeling like that they couldn't compete with the big chains, the restaurant on premise at that time. That was the major obstacle in the small businesses. Um, so as that grew and I left that position, I started working for the Restaurant Association of Maryland and became a server trainer. So I helped them develop one of their first training courses through their education foundation, and still bartended on the side. So it was quite interesting to understand that people in the industry really wanted to make a difference. Many times they did not have the education. They didn't know what they could do in their jurisdiction. They didn't understand why this was important to really learn how to create your own policies in your business. So that was really the basis of where I started moving forward in government. I was also, after I stopped working in the industry, I was working, writing grants for HHS as a contractor, Health and Human Services locally for substance abuse prevention. And they were really taking away that whole grant, that whole program. So I had to scramble. And that was where I found RHI, I would say, or RHI found me. I'm not sure which, but it was really great to look at some at the time of the Hospitality Resource Panel model. So I really wrote my own grant with the Governor's Office of Crime Control and Prevention in the state of Maryland, and worked closely with that office to create a really a division from the Department of Liquor Control for community outreach. And that was a really pivotal time in my life, because I got to work in an organization that not only sold the alcohol, it's a control system, but also regulated the alcohol. And although I wasn't a regulator at the time, I got to be the middleman. And it was really, really fun to work with the businesses, and almost like being a bartender, but working with the businesses to help them achieve their goals, but also understand policy and how they can make their businesses safer. So from there, I moved on to as a division chief. They created a new division, licensure, regulation, and education. I vied for that position. Um, I was a woman in a very man's world at that time, mostly male dominated regulate alcohol regulators. So that was a lot of fun for me. And I ended up, I'm still doing that job and acting director. I love that job for the past almost 15 years. So it's been really interesting to come from a different, all kinds of different backgrounds to be able to share that knowledge and bring that to the table as a regulator.
It's really quite fascinating the way you've kind of built a gumbo out of your experience.
Yeah.
And it seems to me, when you think about regulators, for the most part, the general public might think they're just trying to control businesses, and they don't necessarily understand the businesses. But it seems that what you bring to your role is not only just an understanding of the businesses because of your extensive background within the and outside the industry, but also your early work in social work, which really is about building collaborative and building strategies to help people to help themselves. And it seems that that's reflected in your work, the way that I understand it. But how do you see the whole field of regulation and all of your peers in alcohol regulatory agencies evolving? What's the new insights, and how has COVID begun to shift what might be the traditional approach to regulation?
Well, even before COVID, you can see the shift and the changing atmosphere of regulation, really to get ahead of it and to be proactive. So to educate, you know, education builds capacity, as we know. So to educate people in the industry, let them create their own policies and understand what they can do. So the regulators, I saw things as I took the word sting out of everything that we did. There was no such thing as a sting operation. It was a compliance operation. So instead of having people come before our board of licensed commissioners with sale to minor violations, we had them calling us and saying, I'm so sorry, I know you educated me about this and I knew you were coming. You told me you were coming. You showed me pictures of the people that would be coming to my business and I still sold. I wasn't paying attention. So we really changed. And, I consider myself a community mobilizer. And it took a lot, sometimes it takes a long time, but it took a long time to mobilize that community and get them to understand that we are going to be out here. This is a fair program and we're going to educate you before, we come out and test your business. So doing things like that, it's a lot of work. It takes a lot of time. You have to be willing to put in the effort, but I see regulators that are successful and that understand their businesses and their community. This is the way we have to, do it. There'll still be violations, but the people that have alcohol licenses in our community know what's expected of them.
Now, you're in a unique regulatory system because most alcohol regulation is done through a state entity. And while you do have a state entity, you have pretty much free reign in a lot of ways in how you regulate your county licensees, to the extent that you're able to adapt the state requirements to better meet your local needs. Do you feel that this kind of post-prohibition, everything is centralized in the state with limited local control, or at least at the county level, is contrary to the type of work that you're talking about, which is much more interactive and compliance building and trust building? Do you see that? How do you see that from your experience with other regulators? Do you see them as being less capable of doing the things that you do?
I don't know if people are less capable, but I do think that I work with all the jurisdictions. There's 25 liquor boards in our state, and although they're state laws, and we have to bring local licensing changes or any type of local alcohol laws to the state for approval and for those bills to pass. Um, Local is where we have to be, because even in our community of over 1 million people, we have lots of different jurisdictions that reflect even that jurisdiction in that community. So it's the same with the state. So although we have 25 different jurisdictions and we have weekly calls now, COVID started that, and it's a communication call that I started as president of those jurisdictions right after the pandemic hit, and we still do it for an hour every Friday afternoon. And people that weren't speaking, that are in smaller communities, are now speaking, and we're all learning more about that jurisdiction. And sometimes there's only one regulator for a whole jurisdiction. So it's understanding their limits, and how, they're really getting to understand that there's people around the state that can do more with less, or that they need more, having those conversations about the various liquor boards. So it's been I think COVID has given us this moment in time to really learn more about, for us, our whole state. But I do see the change in communication, um, from around our state. And that was really COVID induced. We had monthly calls and hardly anybody spoke. And it was like, oh, it's the time for the call. Now it's a very exciting,
Mhm.
we have to end the call now. So I think that people are communicating first, and that's just the very beginning of a long process. But I think, we'll never have consensus, but we will have communication.
And this is all principally those that are that are involved with alcohol regulation. But as you know, with COVID, all of a sudden, the local authority or the state authority around alcohol has almost been usurped by the health department, who came in and basically started to say, we're going to determine hours of operation, and we're going to determine occupancy, and we're going to determine, how businesses are going to operate. So this kind of threw a kind of a change into a model that's been around for a long time. What benefits have come from that, and where do you see the challenges in the future?
Yeah, there are going to be challenges. I do think that in our community we were in a great place with the health department, because we do have a what's called a safety alliance, where we have multi agencies working together, but we all still went our separate ways in many ways. So now, it's if there's a new executive order that's put out because due to COVID restrictions, uh, sometimes we'll say, oh, that doesn't really make sense. We need to go talk to the health department. We might have to tweak this a little bit, because they don't understand, really, the hospitality industry, as well as maybe my staff does, or we do. For instance, to put a limit on the time, how long somebody's in an indoor business with a 25%, um, capacity restriction. Well, if there's only 25% capacity restriction, you're going to want to turn your tables. You don't want anybody sitting there for 2 hours, 3 hours,
Mhm,
4 hours.
mhm.
So, that would be something that would be self-induced by the business itself. So I do understand not wanting people to be in a business for a long period of time. So we just have to educate each other, understand why some of these rules are being made through the health department. Mostly it's science, mostly it's numbers, but understanding that when you're in a business and you're relaxing and you're enjoying yourself and you're having a beer or two, you're not going to put your mask back on. So just understanding those kind of things. So we've taught each other, and I think that it will be an ongoing relationship. Um, and again, increased communication.
Yeah. All right, well, we're getting close to the end here. If we were to have this conversation 18 months from now, and we were going to look about the what we call the social economy, and now you're beginning to see day life as just an alternative to nightlife. And I think probably, at least for the next year, people's concerns about congregating, at least in areas that have been strict about their policies. Some states obviously are quite open as if nothing's happening, but there are those that have instilled this caution. So over time, people will get back into the swing of things. So maybe 18 months from now, there'll be things that have changed. But how do you see how people will socialize when you start to get more into the new realm of change in our society? And what changes have you put into place now, whether it be in expanded outdoor seating and dining and other types of things that will remain, or what do you feel has been positive in terms of COVID? While we understand the unfortunate implications to businesses and some of them losing their businesses, are there positives that may benefit how people socialize and way businesses operate, way communities organize their social economy?
I think the spaces are changing, for now, anyways. People are being approved for, alcohol consumption areas. There's a lot of outdoor spaces now being used, and which were never used before for alcohol consumption, which is really exciting and really fun. We have some beautiful parks here and beautiful places people can go, but then we want to make sure they're safe and that the people that are, taking those carry out products to that area remain safe. One thing that we're doing right now, just to prepare, is we've created a state certification for those types of environments and those people that are working in those environments that aren't used to dealing with alcohol. They didn't grow up thinking, oh, I'm going to go bartender, I'm going to work in the hospitality industry, or they never had a job in hospitality. They went to work for parks. So we're educating them virtually. We've created a training. We're educating people that are working in the revenue authority that are now running golf courses with alcohol that weren't planning on doing that before. So the people that normally wouldn't be that target audience being trained and educated, we're hoping, I think we're going to end up training 600 people in the next 2 months, just people that normally wouldn't be trained. So I think it's exciting because you get to educate people that you didn't think they're going to come from a different perspective, and we're going to learn a lot from them as well. So I think we're going to be changing things. There's going to be a lot of areas that aren't directly sold. So those people aren't going to see the changes in people while they're serving them. They're going to just plunk down a carry out order. So we'll have a little bit of challenge, but I think there's going to be great opportunity for outdoor events, outdoor festivals, round the clock kind of entertainment venues that normally wouldn't have been entertained. People wouldn't think about it. So we'll be using other spaces that we weren't using. We're going to liven up some alleys, and we're going to brighten some spots that were otherwise dark. So I see that as an opportunity for us to, as we reopen, to really start moving, get excited about it, and help the businesses that want to do these types of things.
Okay, well, and then we should obviously have a follow-up conversation of how that might impact and affect issues around sound and people's concerns about
Yeah.
that. But, these are the challenges that would be positive, because clearly you're creating the social experiences so that everybody doesn't just think about nightlife as how we socialize, that there'll be a whole lot of shifts in sociability. Well, this has been a great conversation, Kathie. I appreciate you taking the time. You are obviously inspirational to other regulators. I know you've been responsible for a number of awards that have come to the county because of your innovative work, and I'm sure that you'll continue to do that.
Thank you, Jim. Appreciate it.
Okay.